Paid sick leave. It seems like a very basic job benefit, but 46 million working people in the United States don't have it. In 2006, San Francisco voters decided that this kind of situation was unacceptable.
What we found is that we were getting the same stories over and over and over again. We saw workers and talked to workers who said, you know what, I don't even expect to have paid sick days, I just work through the pain. We also found that 86% of food service workers, so these are the people who are making your food and serving your food, 86% have no paid sick days. There's a vivid memory I have of walking into the Cheesecake Factory restaurant. There was a server who was wearing sunglasses. And I thought, well, that's kind of odd. They're very strict about uniforms. And I asked her, I was like, well, what's going on? She's like, well, you know, I have pink eye conjunctivitis, which is contagious, but I tried to call in sick, but we don't have sick days, and my boss said he would fire me if I didn't come in. So he let me wear sunglasses. So we're looking at a real, at a public health emergency besides just like a human rights issue.
San Francisco mandates that all workers in the private sector and the public sector receive up to 9 paid sick days during the year. So, and a worker can use paid sick days to care for themselves when they're ill, or for family members, which is siblings, grandparents, or children when they're sick. Some of the key elements of the law are that it applies to every single worker, so that includes part-time workers, and there's no minimum hours. And it also includes workers in small businesses, which are usually exempt. For small businesses, there is a cap of 5 days, so they provide fewer days than larger businesses.
My question is about how it protects specifically undocumented immigrants, not just, you know, documented immigrants.
Our interpretation of the law in San Francisco is that it does, because it applies to any worker that is working. But I mean, the restaurant industry would fall apart. I mean, it's 80% undocumented workers, I think, in San Francisco.
One reason I work hard on these issues is I wasn't fired by my 250,000 constituents for having birth and having a child. But when I worked for New York State and had my first daughter, I was literally terrified I'd be fired. And I called the personnel office, this is a true story, and I asked them, what about your leave policies? I'm going to have a child. And their answer to me was, women just leave. And I have some stats that show not only are we 139th behind the countries from the Harvard study in paid sick leave, but we are tied for last in paid family leave. 163 countries guaranteed paid family leave, so we're tied along with Swaziland and Papua New Guinea. For a country that talks about family values all the time, how many times do you hear that? Family values. We have not passed on the federal level anything to help families since 1993.
Good. We travel on subways. We don't have cars generally. So the notion of spreading diseases is always a concern. I do think that in New York City, this is a good time to be thinking about this for several reasons. First of all, we have a booming tourism restaurant industry, and I think San Francisco is the model where you know that these industries we no longer have manufacturing in terms of the depth that we did before, and these two industries in particular, with all the hospitality in general, are the new backbone to a certain extent, not talking about some of the financial industries. But these industries have a lot of need for this kind of legislation.
2/3 of the respondents, both those at 100% of poverty and at 200% and below, say they want paid sick leave. They think it would be important for themselves and their family. This is also true for people above those income levels. So there's a broad political consensus that we're starting to pick up. The problem is, and the thing that you talked about, is that we're going in the wrong direction as we've done this survey. And in '02, essentially, we had about 40% of people who had sick leave. It's now crept down to 34%. The trend lines are all going in the wrong direction. People are losing this benefit who are the working poor like crazy. And this is the time to start bringing it forward.
But let me, in all fairness, offer some of the reasons why we wouldn't want to give benefits to those workers. And to do that, I would like to turn to a web memo from the Heritage Foundation. So, invited, but they did not come, so we instead will, I just want to quote from this memo: mandatory paid sick leave invites misuse that harms coworkers and customers. And the three arguments, and let's address them somewhat seriously. Some workers have used the Family and Medical Leave Act to excuse tardiness and to skip work. Coworkers face the burden of covering for shirking employees who misuse their leave. Customers suffer unpredictable delays and shortcomings in service. And to back up these claims, this is the evidence. One large manufacturing company has found that almost half of their FMLA leave has been intermittent leave of a few hours at a time, and that workers often use the leave to avoid discipline for showing up late. Other companies have found that workers use FMLA leave to avoid working undesirable shifts. Verizon has found workers who are taking FMLA leave for back pains, but who are nonetheless well enough to fly to Disney World for a family vacation. I will say that this paragraph, which wouldn't pass muster in a Drum Major Institute memo to explain something that affects millions of people, this is the research by Anecdote, which is actually not even their anecdotes, but commented in response from somebody else, the Manufacturers Alliance testimony in front of Congress, so it's 3 times removed. Those are the arguments against by one of our most prominent, well-funded, well-organized right-wing think tanks.
What issues have come up on the implementation? Because you wrote a great law. It's a great law. But as we all know, as great as the law can be, it doesn't mean anything unless people take advantage of it.
I think a lot of the issues are going to be around the tracking and also the denying people leave and retaliation. But a lot of what happened in the implementation is employer confusion. A lot of people just didn't know how to track it, didn't understand accrual. There was tons of questions about independent contractors.
And I always like Martin Luther King's comment that we go farther, faster when we go together. So my question is, how we move from values that are widely shared to public policy.
We walked in with our committee, which is representatives from all of our coalition members. So restaurant workers from Chinatown, representatives from Parents' Voices, which is a group I didn't mention, our workers who came in with skateboards and they had to be confiscated at the door because they thought they were weapons. For us, our biggest opponent was the restaurant industry. The Golden Gate Restaurant Association tried at every moment to kill this bill and were difficult to work with. And I wish that we would have started earlier to work with them.
What you saw today is a model in which local organizers, this wasn't politician driven, this wasn't a campaign platform, this was local organizers who work directly with those who are most affected by the absence of paid sick leave, identifying their need, coming up with with sample legislation that they could push, winning the battle of public opinion, actually pushing this and winning this electorally in San Francisco. So what it shows to everyone is you can overcome the opposition. In the process, you can educate millions of people about their rights, and I think what's happening in San Francisco will surely be a model for New York and cities across the country.